Welcome to the corticosteroid injection techniques demonstration DVD. Depo Medrol offers relief to your patients who present with joint pain due to inflammatory disorders such as osteoarthritis or joint trauma. You may use this DVD as a resource to aid you in administering soft tissue and intra-articular injections to your patients. Please note that each demonstration presented here is intended to serve as just one example of injection procedures and does not represent the only technique. The demonstrations shown here cover the complete injection procedure, from identifying landmarks and selecting the injection site, to administering local anesthesia if necessary and injecting Depo Medrol. Depo Medrol is indicated as adjunctive therapy for short-term administration in synovitis of osteoarthritis, rheumatoid arthritis, acute and subacute bursitis, acute gouty arthritis, epicondylitis, acute nonspecific tenosynovitis, and post-traumatic osteoarthritis. Some joints may not be suitable for injection therapy. Corticosteroids such as Depo Medrol should not be injected into unstable joints. Likewise, septic joints should not be injected. If signs of a septic joint are present, for example, if there is obvious effusion of the joint is warm to the touch, and the patient has a fever, further evaluation may be necessary before treatment. Depo Medrol sterile aqueous suspension is contraindicated for intrathecal administration. It is also contraindicated in premature infants because of a risk of fatal gasping syndrome, in systemic fungal infections, and in patients with known hypersensitivity to the product and its constituents. Multi-dose use of Depo Medrol from a single vial requires strict aseptic technique to avoid contamination. Corticosteroids may mask some signs of infection, and new infections may appear during their use, especially in patients with immune deficiency. Repeated intra-articular administration may result in instability of the joint. Skin atrophy may occur at the injection site. Prolonged use of corticosteroids may produce ocular damage. Average and large doses of corticosteroids can cause elevation of blood pressure, salt and water retention, and increased excretion of potassium. As with all corticosteroids, Depo Medrol has been associated with post-injection steroid flare, tendon rupture, and crystal-induced synovitis, as well as hyperglycemia, osteoporosis, psychiatric disorders, myopathy, and growth arrest.